July 2, 1944. The underground hospital cave near Cherbourg reeked of blood, smoke, and boiled bandages. Dr. Schwester stepped slowly out of the dim corridor. Her white coat hanging loosely from her narrow shoulders, her hands raised in surrender. She squinted against the daylight she hadn't seen in days. Only hours earlier, in the flickering candlelight of the makeshift ward, she had insisted to her fellow nurses, "The Americans cannot possibly have the medical supplies they claim. It must be propaganda meant to break our morale." Those words were about to be shattered beyond repair. Behind her, 8 German army nurses followed into the light. Pale, exhausted, and hollow-eyed, they were among the first German nurses captured by American forces in France. For days, they had treated endless streams of wounded Wehrmacht soldiers by candlelight, boiling and reusing bandages until they disintegrated, rationing their final drops of morphine. Winds through the treacherous North African landscape. None of them could imagine that within hours they would witness a level of medical abundance so far beyond their comprehension that it would destroy not only their confidence in German medicine, but the very ideology they had been raised to believe. Colonel Richard P. Johnson of the U.S. 45th Evacuation Hospital regarded the captured nurses not with hostility, but with curiosity. They were enemies, yes, but also fellow healers. Under the Geneva Convention, they would soon be repatriated. But first, they would see what American wartime medicine looked like. And what they saw would leave an impression that lasted far beyond captivity. The collapse of German medical illusions had begun earlier, in May 1943, when General Hans-Jürgen von Arnim surrendered in Tunisia. Among the 250,000 Axis troops who laid down their arms were thousands of German doctors, orderlies, and Red Cross nurses from Rommel's Afrika Korps. Women like Ilse Schultz and Greta Falk, decorated with the Iron Cross for bravery, had devoted themselves to the Reich. Yet captivity revealed something they had never been prepared for. The Americans throw away more medical supplies in a day than we receive in a month. One wrote, "They have medicines we've only heard about." The shock began aboard the Liberty ships that carried them to the United States. Mass-produced vessels the Nazi press had dismissed as a fantasy. The ship's infirmaries glowed with electric light, stocked with X-ray machines, sterile supplies, and refrigerated medicines. Blood plasma was stored safely in labeled units, eliminating the dangerous direct transfusions German doctors still relied on. For women who had worked by candlelight and measured sulfur powder by the grain, it felt like witnessing sorcery. Once in America, the revelations multiplied. Upon arrival at POW camps, the nurses received complete medical examinations, dental care, eyeglasses, and treatment for chronic ailments. They were well fed, and at Christmas, given chocolate, cigarettes, and soap, luxuries their families in Germany had not seen for years. For women raised on propaganda that painted Americans as decadent and cruel, this generosity toward the enemy was more shocking than any technology. In camps like Opelika, Alabama, German nurses worked in fully equipped hospitals, sometimes side by side with American staff. They saw adjustable surgical lamps, electric cauterizers, autoclaves, and shelves lined with hundreds of medicines. The greatest revelation of all was penicillin, the miracle drug America was producing in billion-unit quantities. Where Germans amputated, the Americans saved limbs. Where infection meant death, they restored patients to health within days. Then came a revelation that struck even deeper. Many of the American nurses were black women, educated, professional, competent, and in positions of authority. These women corrected German techniques, issued orders, and treated wounded men with expertise. Everything Nazi ideology had taught about race disintegrated in the face of such undeniable skill and humanity. By 1944 and 1945, German medical personnel in captivity were studying American public health methods, vaccination campaigns, epidemic control, sanitation. They read from American textbooks and discovered that many of the scientific breakthroughs they admired had been made by Jewish researchers, those their regime had exiled or murdered. The dissonance was overwhelming. They had been taught that medicine served ideology. Now they saw that true medicine served only life. When the war ended, the surviving nurses returned to a shattered Germany. Its hospitals in ruins, its people starving, its doctors gone. They carried with them more than just new medical skills. They brought back a new understanding of what it meant to heal. They founded modern nursing schools, rebuilt hospitals, and introduced innovations like blood banking, antibiotic treatment, and professional nursing autonomy. Years later, many of them would reflect that captivity had changed them more profoundly than war itself. One arrived as prisoners. One wrote, "WWII left as witnesses to medicine's true purpose." Their story remains one of the quietest but most profound victories of World War II. Not one with weapons, but with compassion, science, and truth. Through the undeniable evidence of superior care, America achieved something ideology could not withstand: the transformation of belief itself. Those captured nurses became messengers of a new world, one where healing triumphed over hate, and the practice of medicine, freed from ideology, became a symbol of humanity restored.